Let's talk about treatments for depression. I want to break down treatments of depression into three main categories. We want to look at lifestyle, therapy, and medications and how they can help someone with depression. Start with lifestyle. Two big ones that I like to kind of start with. One is exercise and the other is light exposure. The light therapy is something that can be done from the sun, especially in the morning, getting outside, getting some exposure to the light. For people who have difficulty with that, there are some happy lamps that they can actually buy. I recommend looking at Carlat Report Light Therapy. They give some good guidelines on how to actually look at what kind of light boxes are evidence-based and are helpful if you're going to go that route. It's a powerful intervention that can have an effect, and we've seen it in studies. The second lifestyle intervention that I talk about a lot is exercise. This can be difficult to really get started with someone who's feeling depressed. It's not always the most easily done. What I will say is when someone can take even the smallest step towards increasing their physical activity, it has a very strong effect on depression. Studies showing people having effects that can't even be close to medications in some studies. Exercise has so many impacts on our body. The increased metabolic health of our cells, the overall brain drive that can affect our cognition and neuroplasticity. So then the second area we can look at is therapy. And I'm going to put a list up here. You can screenshot this right here. 7 evidence-based therapies that the APA, the psychological APA, recommend for utilization for people with depression. Most commonly, people are using either supportive or CBT-based therapies. I usually am recommending CBT when it seems the depression is not something related to a current social stressor. If it's related to loss of someone or a social stressor, supportive can be a little bit more useful in that time. But if that's not the case, CBT is usually a place that I would start from a therapy standpoint. The third area, that's medications. You'd be speaking to a clinician that can prescribe. A psychiatrist, a psych NP, a psych PA. They would be looking at all of these areas of your life where the interventions are that you are going to benefit from most, and if medications is a piece of that. I would say SSRIs, which is selective serotonin reuptake inhibitors, are the most common first line. These are medications like Prozac, Lexapro, Zoloft, can be really effective for someone with depression.